Hey, whoa, back. Hi, Matt Cash, lymphedema therapist with Lilly Clinic in Roanoke, Virginia. And do you ever wonder why certain things for lymphedema treatment and management work and others don't? Things that work, such as short stretch bandages versus long stretch ACE bandages, or why exercise is effective, or the use of a pneumatic compression device or manual lymphatic drainage, or even good compression. Those things work while a lot of other things don't. Let's get into the physiology, because there's one really important component that if you understand with lymphedema, all the other stuff makes sense. So let's help you understand it. First things first, I want to recognize BSN Jobs because I'm going to use an image from one of their educational posters and to help you understand this. We're talking about microcirculation, very, 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 very small. If you look here, you could see all these vessels, and this is your skin, right? And you see that thing that's circled? Do you see those little holes? Well, think of your skin like a sponge or Swiss cheese. It's full of holes. You can see that right there. Let's blow that up. Boom, there it is. You have a little blood vessel that comes in. That blood vessel brings in blood. That blood nourishes all those skin cells in these spaces. Thousands and thousands and thousands of spaces just under your skin. That blood comes in, releases vitamins, minerals, oxygens, all those things, and all these cells use that. They eat it. They spit out waste product. Most of that waste product gets back into this vein and then out and then through these large veins that go up your leg to remove fluid. Well, you know what it doesn't do? It doesn't remove everything. See this green thing? That's your lymphatic capillary vessel. What does that do? That removes fluid too, just like your vein does, but it removes things differently. The way fluid gets into a vein is it's able to pass through the membrane like a screen. But that screen doesn't allow large particles to get into the vein. You know what large particles are? Cellular debris. When our cells die, they got to be cleaned up. If you have a wound, a lot of debris needs to be cleaned up. Too big, can't get in a vein. Must be get in the lymphatic system. Viruses, cancers, bacteria, large particles can't get into a vein. We don't want a bacteria in our vein, then it's in our bloodstream. Bad. So we have this thing called a lymphatic vessel. You know how that works? Well, let's look at this. You got these lines. There's the vessel. Those lines attached to the walls of this space. Well, your skin is soft, so when your skin moves, those lines get pulled. And do you want to know what happens? If you're one of my patients, you have seen this. It's been with me for almost 9 years. This is my homemade lymphatic capillary vessel. These lines, I don't know if you can see them, those are those anchoring filaments. Those lines attach to the walls of that space. So if I grab that skin and I stretch it, those lines get pulled. What happens? Doors open in these vessels. All these doors open. You can see it here. They open. What happens when they open? It allows for large particles, viruses, bacteria, cancer cells, cellular debris, junk from a wound. It's able to get into this lymphatic vessel, and now it's traveling through the lymphatic system where it eventually gets to your lymph nodes, kills all that bad stuff so it doesn't harm us and it keeps us healthy. It's amazing, right? This is really important stuff. So if you have lymphedema, you know why this matters? I'll show you. Everything I mentioned, the short stretch bandages, the use of a pneumatic compression device, manual lymphatic drainage, good compression flat knit garments, yes, they do this, and exercise. When we stretch our skin, when this is applied, not ACE, it's not elastic, so it's breathable. So when you're moving, it's doing this. It's causing your skin to stretch. When you get manual lymphatic drainage, we're stretching your skin. When you're using your pump, you're stretching your skin. When you have good garments and you're moving, it's stretching your skin. Every time your skin stretches, these doors get pulled open. And when those doors get pulled open, that material, that thick stuff that's trapped in your skin, finally gets into the vessel that it needs to be removed. ACE bandages and things like that only put pressure on that doesn't breathe. It's not working. There's not a working phase and a resting phase. Working phase, resting phase. It's static. And that static is pushing fluid into a vein, but all those particles that should be removed by your lymph system remain. So your skin gets thicker and thicker, more fibrotic, and it becomes more difficult to manage your lymphedema. So the right products and the right treatment actually matter, because what we're trying to do is stretch your skin. And if it's compressed like this, it ain't stretching. We want it to move, because every time your skin stretches, these doors open, fluid goes in, edema reduces, you feel better. Understanding the physiological aspect of your lymphatic system helps you understand why things are helpful for your lymphedema while other things are not helpful for your lymphedema. I hope this helps. Movement. When you stretch, when you're stretching, when you're doing yoga, when you're walking, your skin is moving. When you're not moving, your skin's not moving. These doors aren't closing. You see what I'm saying? Movement, exercise, the right products matter. Hope that helps.